Welcome to tulipoet.com.
Occupational English Test. Listening Test. Part A. In this part of the test, you'll hear two different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1. Questions 1 to 12.
In this part of the test, you will hear nurse Naomi Hall speaking to David Mackenzie, who is a carer of his wife Jill, who has a terminal condition.
For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Oh, good morning, David. How was your weekend?
Oh, morning nurse. It's a little bit tough actually this last weekend.
Yes, I'm sure it has been. I just wondered, could you tell me a little bit more about how it went?
Well, it started on Saturday night. Jill had quite a restless night. There was breakthrough pain at time and I was giving the medication, but I didn't feel it was as effective as it had been in the past.
So you have been giving the same medication regularly, but you're not getting the effect that we were last week, for example.
No, that's right. And, I could see by her expression that she was quite uncomfortable. So, yeah. And again, the same thing happened last night as well. We had a similar
So
situation.
you've had 2 bad nights. And is she able to eat anything?
I have been trying, to give her, different things like food, but she really has only a small appetite and mainly just fluids.
Is she having much fluid?
A few sips, a few glasses of water. We have tried some green teas and various things, but that's about it.
Mm-hmm. And is she still able to walk around a little bit?
She did walk out, yesterday, and she went out into the lounge room and, we got her to sit down and watch a little bit of TV, but she tires very quickly.
Mm-hmm. And what about her general mood?
She's not saying too much, and the kids are around too, but she, I get the feeling that she is getting a bit depressed.
Mm-hmm. And have you had any visitors at all to sort of break the monotony?
Not this weekend. I mean, we have been pretty lucky with visitors and people coming, but this weekend we didn't.
Right. Now, I know you've got the 2 boys, David. What age are they again?
The older boy, Michael, he's 13, and his brother, Tommy, is 11.
I see. And how are they coping? What about school? Are they managing there?
To be honest, I haven't been paying too much attention. They say they're doing the schoolwork, but look, they're missing their mother because she was always the one who spent time with them after school, and she, now she can't really do that, and so they're sort of playing up a little bit.
Yeah. Is the school aware of the problem? The teachers realise that the pressure that the boys
Oh
are
yes,
under?
yeah, the school's been great. There's no problem there.
Oh, that's good. And is there any family help that you can get?
Well, I have had some help from my sister, and she's been great, but she's got her own job and family to look after, so it is getting a little bit tough, and I don't really want, and certainly Jill doesn't want it, to be a burden on other people.
Yes, I can understand that, although I think people sometimes feel a great satisfaction in being able to help. But how about you, David? Are you still doing some work?
I was up until about 2 weeks ago, but I'm taking a bit of a break. It is a little bit tough financially, but yes, I just want to be with Jill and make sure she's as comfortable as possible.
And are you getting any break from that at all? Sometimes just to get away by yourself for a little while?
Not actually recently.
No, well, I'm looking at you and you're looking very tired.
Yeah, I guess I'm a bit tired. But, look, I promised Jill that, we'd get through this. And so that's what I'm trying to do.
Right.
Extract 2, questions 13 to 24.
In this part of the test, you will hear a doctor in a private clinic interviewing a patient.
For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Tell me, what can I do for you today?
Well, I have a slight problem with my head. I was at work last Friday, and I slipped on the polished floor and banged my head against the wall. It's Monday today, so all over the weekend I've been experiencing a headache, so I've come in to have it checked out.
What happened when you slipped?
I lost my balance, fell over backwards, and hit my head against a brick wall.
And what happened then?
Well, there was a wooden ledge jutting up, and I hit my arm on it as I was falling, and at the time I only felt dizzy and slightly nauseous, and which I put down to just a dizziness of spinning round and round. I also hit my arm, my elbow, on the wooden ledge, and that was very sore at the time, so I didn't pay very much attention to my head, and at that point I went back to my desk, and I just sat down quietly and tried to get on with my work.
Right, and was there any loss of consciousness when you hit your head?
No, because I remember talking to myself during the weekend and trying to recall what happened after I hit my head. I remember thinking, I think my head is hurt, but my arm is sore. Should I get up? Should I get up from the floor?
And do you remember all the events that occurred before you hit your head?
Yes, all.
You're not remembering because someone told you what happened?
No, because I immediately went back to my office and recounted the experience to my workmates.
And you felt nauseous and dizzy and you had a sore arm. Afternoon or was it morning?
It happened about 12:30.
Did you eat your lunch?
Yes, I did. I had a sandwich for lunch.
Did you vomit that up?
No, it wasn't that kind of nausea. It didn't last for very long.
So you had nausea at lunchtime?
Just slightly giddy.
And what did you do for the rest of the day?
I carried on much as usual and trying to work on my computer.
And were you able to do that okay?
Not really. My arm was still painful.
So your arm was still taking priority over your head at that stage?
My head wasn't sore at that point. I was just slightly dizzy. I just carried on until I came home on the Friday night, and I rested.
Were you sleepy in the afternoon? Sleepy while trying to work?
Yes, I was always, slow to react. I went straight home after work, sat down on the couch, and felt very drowsy.
But you didn't fall asleep in the afternoon, although you would like to, perhaps. You were able to stay awake.
My arm was still sore.
Ah, right. Okay. So you got home, then what happened?
I arrived home. I did a couple of things. I just sat down on the couch, listened to the music, and I fell asleep.
Right. No evening meal? You didn't eat anything?
No.
Went to sleep that night?
Mm-hmm. I woke up the next morning. I slept very late, and I woke up with a very, very bad headache.
Where was your headache?
It was at the front of my head. I hit my head at the back to the right, a big lump and bruise, and it was very sore there. It was also sore, the pain was transferred right to the top of my head towards the back, and I thought it would go away, so I tried to do some work that I'd brought home from the office.
Were you able to concentrate?
No, I couldn't concentrate, and it was a very, very bad headache, and it made it even worse. I had trouble. I couldn't really focus properly.
You were having trouble with your vision.
And looking around, and it made my head sore, and I was also very tired as well.
And that was Saturday morning? What sort of work were you trying to do?
I was trying to read a book, like I was reading through a book.
Would that require a lot of concentration normally?
Yes, and I realized I just couldn't concentrate. Also, I had something to eat for lunch, and I went to sleep, and I slept for 4 hours in the afternoon.
Is that the normal thing for you to do on a Saturday afternoon?
No, not for 4 hours.
No, you don't have afternoon rest during the weekend, just...
Well, maybe at the maximum an hour, not for 4 hours, seeing that I'd only woken up at 10 or 11 o'clock in the morning anyway.
Right.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
You hear a discussion between a nurse and a physician explaining about ingredients used in a vaccine.
Now read the question.
Hello, doctor. Can you explain what ingredients are used in a vaccine?
Well, chemicals used in a vaccine include a suspending fluid, such as sterile saline or fluids containing protein, preservatives such as glycine, albumin, and phenol, and enhancers or adjuvants to improve the effectiveness of the vaccine. Some vaccines may also contain trace amounts of the culture material for the growth of the virus or bacteria used in the vaccine, such as chicken egg protein. Even trace amount chemicals added to vaccines to deactivate a bacteria or virus and stabilize the vaccine and to keep the vaccine potent over time.
Question 26.
You hear a discussion between a nurse and a physician explaining about vancomycin-resistant enterococci.
Now read the question.
Hello, doctor. What are vancomycin-resistant enterococci?
Vancomycin-resistant enterococci are particular types of antimicrobial-resistant bacteria that are resistant to vancomycin. This is often used to treat infections caused by enterococci. Enterococci are bacteria that are normally present in the intestines and in the female genital tract that are commonly found in the environment that can cause infections at times. Most of the times, vancomycin-resistant enterococci infections occur in hospitals. Often the infection is caused in patients with chronic diseases such as diabetes or who have recently received antibiotics. It's also more common in patients with indwelling devices like intravenous lines or urinary catheters and those with compromised immune systems. Vancomycin-resistant enterococci can cause many types of infections, such as urinary infection, heart infections called endocarditis, bloodstream infection called sepsis, abscesses, wound infections, pneumonia, or meningitis. The risk of vancomycin-resistant enterococci infection can be reduced by minimizing the use of indwelling devices, such as intravenous lines and urinary catheters. The risk can also be reduced by avoiding inappropriate use of antibiotics.
Question 27.
You hear a discussion between a nurse and a physician explaining about the causes of Shapara hemorrhagic fever.
Now read the question.
Doctor, how are the Shapara hemorrhagic fever is caused?
A single-strand RNA virus called a Shapar virus of the Arinaviridae family causes Shapar hemorrhagic fever. Shapar virus is animal-borne or zoonotic infection. Limited clinical trial information about this infection in rural Bolivia. Like any other arenavirus, rodents host Shapar virus as a reservoir. Humans can contract this infection with a contact from an infected rodent. It can be direct or through inhalation or aerosolized Shapar virus from the feces or urine of infected rodents. Although there is a possibility of person-to-person transmission of arenaviruses through aerosolization, it's very rare. From the very limited observed cluster of cases of Shapar hemorrhagic fever, there was hardly any evidence of person-to-person transmission.
Question 28.
You hear a dialogue between two physicians discussing about toniasis.
Now read the question.
Hello, doctor. What is toniasis?
Toniasis is a parasitic infection caused by the tapeworm species pork tapeworm, or Tinea cilium, beef tapeworm, or Tinea saginata, and Asian tapeworm, or Tinea asiatica. Typically, people become infected with these tapeworms by eating raw or undercooked pork or beef. Often, individuals with toniasis infection may not know they have an infection because symptoms are non-existent or mild. Especially pork tapeworm infections can result in cysticercosis, a disease that can cause seizures.
Question 29.
You hear a monologue by a physician briefing about rickettsiosis.
Now read the question.
A group of diseases called spotted fever group, rickettsiosis, is called by closely related bacteria. Through the bite of infected ticks and mites, these bacteria spread to people. The most severe and commonly reported spotted fever group, rickettsiosis, is in the Rocky Mountain spotted fever. Other causes of spotted fever group, rickettsiosis, in the U.S. include Rickettsia parkeri rickettsiosis, caused by R. parkeri, rickettsial pox, caused by Rickettsia acari, Pacific Coast tick fever, caused by Rickettsia philippi.
Question 30.
You hear a dialogue between two physicians discussing about healthcare-associated infections.
Now read the question.
Doctor, what is the cause healthcare-associated infections?
Different types of healthcare-associated infections, including pneumonia, wound, bloodstream infections, or surgical site infections, and meningitis caused by Klebsiella, is a type of gram-negative bacteria. Increasingly, Klebsiella bacteria have developed antimicrobial resistance, and very recently, it has developed to the antibiotics called carbapenems. Normally, Klebsiella bacteria are found in the intestines, where they do not cause any disease. They are also found in feces. Commonly, Klebsiella infections occur among sick patients in healthcare settings, patients whose care needs devices such as ventilators or intravenous catheters. Moreover, patients taking long courses of certain antibiotics are at high risk for Klebsiella infections.
That is the end of Part B. Occupational English Test. Listening Test. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
Leonard Caldwell today. We're talking an awful lot about cancer. Can you just scratch the surface for us and talk about some of the causes of cancer? I think a lot of people, there's a lot of misinformation out there, and it seems like everything can be a cause of cancer these days.
Absolutely. We have to make a distinction between two different causes of cancer. There's the illness of cancer, or the symptoms of cancer, and there is the accident of cancer. The accident of cancer, that's how I formed it, is an outside force. If you get radiated to a certain extent, you will develop cancer. That's not really an illness. It's like somebody shoots you with a bullet. It doesn't matter how healthy you are, you still will be hurt or dead. So there are outside causes for cancer, of course, like preservatives and toxemia and these kind of elements. But the main element or the main cause of cancer, in my opinion, is mental and emotional stress. There is basically no other cause for cancer than lack of energy. We are all born with cancer or potentially cancerous cells. These potentially cancerous cells, our immune system is fighting them all the time. From the very first day we are born, it's basically mutated cells, half-dead cells, and so on. And our immune system just grabs it and gets rid of it. When it stops, the only cause for that is lack of energy. And this lack of energy is mainly caused by mental and emotional stress, living in constant worries, doubts, fears, living with lack of self-esteem, lack of self-confidence. The main one is, Scott, lack of hope. That's the main stressor. And with our economy and everything that's going on, of course, so many people have a huge problem with that, with lack of hope. But living in constant fear with being afraid of having not enough money to pay the bills next month, or making compromises against yourself. Most deadly heart attacks happen Monday morning between 8 and 9 o'clock when people get ready for a work week that they literally cannot handle any longer. So they rather die, literally, rather die than go to work one more day. We all need to understand that cancer is not even an illness. Cancer is a symptom. And a tumor, for example, is nothing else than the approach of the body to keep us alive. We have so many toxins in our system that would kill us. So the body builds a bubble, a bucket, a tumor, and collects all these poisons and basically keeps the poisons on one spot where they don't do harm. That's a tumor. So the cancer is basically your friend. The tumor is working on keeping you alive. So that's why it's so dangerous if anybody comes with a needle biopsy, for example, and pinches into this tumor and releases the toxins into the system, and all of a sudden they find you have a very fast-growing, very aggressive cancer that you didn't have before the needle biopsy. The same problem occurs with mammography. If somebody has a lymph node, for example, our lymph nodes are basically, just to simplify it, our physical immune system. They collect all the poisons, dilutes, and basically help us to get rid of all these toxins. So if a lymph node is really full with toxins, and we have 4 times more lymph liquid than blood, so there's a lot of toxins, a lot of lymph liquid to work through. If a lymph node really works really well and collects all these toxins, and sometimes there's just too much in it, it gets inflamed, so it takes a while longer to get rid of these toxins, to neutralize these toxins. So when you have a mammography, they put 50 pounds of pressure on the most gland-landed tissue in the female body, the breast. If this lymph node is now looking like a pimple that's ready to burst, and you put 50 pounds of pressure on that, that cannot be a good thing. Usually it bursts, and that's what causes cancer. So it's not like just statistically every mammography raises the cancer risk 2%, but it's also mammographies can cause cancer just by the pressure that's applied, for example.
Now look at Extract 2. Extract 2. Question.
You hear the doctor giving a lecture on colon polyps and its treatment.
You now have 90 seconds to read questions 37 to 42.
A colon polyp is a tiny growth of tissue projecting from the lining of a section of the large intestine called colon. Polyps are common and occurs as people age. Usually, colorectal polyps in the rectum or colon occur in 30% of adults above 50 years in the U.S., while in children, colorectal polyps occur with an estimated 6% affected to 12% in those who experience intestinal bleeding. Although most colon or bowel polyps are harmless, some polyps develop as cancer that takes many years to turn cancerous. The most common types of polyps are hyperplastic polyps and edematous polyps. Usually, hyperplastic polyps or inflammatory polyps are harmless and not a cause for severe concern with a low malignant potential. Rarely, these polyps become cancerous. Although edematous or edematous polyps are not cancerous, they are potential enough to become cancerous in the future. Larger edematous are more likely to become cancerous. Resection of edematous polyps is usually recommended. Malignant polyps contain cancerous cells. The best treatment for malignant polyps will be based on the severity of the cancer and the overall health of the patient. The symptoms of colon polyps are: rectum bleeding is the most common symptom of polyps, though it can also be a sign of other conditions, such as minor tears in the anus or hemorrhoids. Large polyps that block the bowel movements partially can cause abdominal cramps and pain. Heavy bleeding from polyp can make the stool appear black, while minor polyp bleeding can cause red stripes in the stool. However, other factors such as medicines, foods, and supplements can also cause a change in the color of the stool. If a polyp bleeds slowly over time, it may cause an iron deficiency in the patients. Usually, iron deficiency, called anemia, causes pale skin, weakness, shortness of breath, fainting, or lightheadedness. There may be a change in bowel movements lasting longer than a week, including diarrhea or constipation. Eating too much of red meat may cause the risk of colon polyps. Although etiology of colon polyps is not yet known, their occurrence may be connected with certain lifestyle factors, such as a high-fat diet, eating too much red meat, not including adequate fiber in the diet, smoking, obesity. Genetic factors can also cause the colon cells to multiply over and above and form polyps in certain individuals. Certain individuals are more likely to develop colon polyps if they have inherited conditions, such as familial edematous polyposis, Gardner syndrome, or Peutz-Jeghers syndrome. Colon polyps are usually removed by the following methods. In the colonoscopy procedures, a cutting instrument or an electrified wire loop on the end of a colonoscopy is used to perform a polypectomy. However, smaller polyps are raised and isolated from the surrounding area for easier removal by injecting a liquid underneath the polyp. In a laparoscopy, a small incision is made into the pelvis or abdomen. An instrument called a laparoscope is inserted into the bowel. This technique is used to remove very large polyps or if the polyps cannot be removed safely by colonoscopy. Removing the colon and rectum. In this procedure, called a proctocolectomy, is only performed when the patient has severe condition or cancer, in which the colon and rectum are removed surgically. This method is suggested for patients with rare inherited conditions, such as familial edematous polyposis that causes cancer of the colon and rectum, and polyp removal may prevent further development of cancer.
That is the end of Part C. You now have 2 minutes to check your answers.